If you were to walk into any emergency room in New York City, what would you look for first?
I think the key is to actually not walk into the emergency room unless you're absolutely critically ill. We want to keep people out of the emergency departments to make sure that the space is there for the patients who need this critical resource the most. You're going to see sick patients in the emergency department now. A lot of emergency departments are separating patients using tents to separate out COVID-likely patients and COVID-unlikely patients to reduce the risk of spread in waiting rooms and things like that.
Lauren, we have seen in the last couple days the beginning of an understanding of this virus with the ebbs and the flows, and of course all focused on the Prime Minister of the United Kingdom. But for each and every virus patient, there seems to be a point where they get better and then they get worse as well. What have you learned with the Johns Hopkins medical team about the ebb and flow of the virus, the day-to-day of this pathogen?
One of the things we've seen about these patients is that they have to be watched really carefully. Their oxygen saturation can look like it's going to be fine and then really go off the rails. We've seen these patients, we really need to pay a close eye to them to make sure that they're at the right resource level for managing them. So trying not to move them out of the ICU into a step-down unit too early with the risk that they might get worse and then have to be moved back to the ICU. You want to avoid transferring patients as much as possible and reduce the number of transfers.
Within our public health system, with a beleaguered New York, and yes, there's other geographies across this country that are just overwhelmed right now, it's a movement from the emergency room to a hospital bed, and then as the Prime Minister to an intensive care unit. Explain the differences of ICU. Explain the nuances there that we need to know.
Sure. So when a patient's moved from the emergency department, depending on how sick they are, they may go to a regular floor bed or up to the ICU. And that ICU level of care is really important for these patients who may need mechanical ventilation or other higher level care. That mechanical ventilation piece is really important. So if someone can't breathe on their own and is going to need to be intubated and mechanically ventilated, which we've talked a lot about with these patients, you need that ICU level of care because the staffing is higher. So you have more nurse-to-patient, higher nurse-to-patient ratio, higher level of critical care doctors, and you have the respiratory therapists you need to manage the ventilators, and you have the anesthesiologist there to manage the levels of medication that these patients require.
Explain to us your view on this debate of the protection of nurses, the protection of doctors, and indeed of all of hospitals in America. It's a raging debate right now about getting protective gear in. Give us your perspective, please.
Absolutely. We absolutely have to keep our medical staff, our frontline healthcare workers healthy because the patients are going to keep coming, whether the physicians and the nurses and the respiratory therapists and everyone else who keeps the hospital running is there and healthy or not. So the personal protective equipment, or we call it PPE, is critical to protecting these healthcare workers. You need the masks or the PAPRs, the personal air purifying devices, so that you can safely come and go from these patients' rooms. You can safely do the procedures you need to do to keep the patients breathing. A lot of our procedures that we do for these respiratory patients generate aerosols or small particles that have the virus in it. So the PPE is critical to keeping healthcare workers safe and the hospital running.